So I've told you before, here in central Nebraska, I would say 70 to 80% of my customers go with a Medicare supplement, also called a MediGap plan, whereas probably 20 to 30% of my customers go with a Medicare Advantage plan. I do like both plans, but I'm going to actually read you the MediGap or Medicare supplement con list. So these would be the things that are probably not as good on a supplement plan as compared to Advantage. Things that I would consider negatives. Now, some of these do have some positives as part of it, which I'll get to, but these are the 4 things that I wrote down that can be a negative to being on a Medicare supplement plan. Number 1, higher monthly premiums. So when you're first coming on at 65, let's just say anywhere between 65 and age 70, usually if you go the Medicare supplement route, you may pay anywhere from $100 to $130 more per month overall compared to going onto an Advantage plan. So obviously the negative there is you're going to be spending more money every single month. The positive there is, like they always say, usually get what you pay for. Even though you're paying more per month, you have a better idea of what your maximum out of pocket is. For most people, it's just $226 is the yearly deductible and max out of pocket on anything medical. And also, when you're on a Medicare supplement, there's no doctor network. So even though you pay more, yes, that's a negative, but it's also kind of a positive. Number 2, annual rate increases. Now, if you're on a Medicare Advantage, they don't really go up every year. They just redo their plans every end of the year in the fall and come out with new plans or update plans, but usually they stay pretty much the same, don't really change much. On a Medicare supplement, they usually at renewal for most companies, they will give you a rate increase. Usually it's just a few percentage points every year, but over time that adds up. So that is a negative. I will say on that, what you can do if you stay pretty healthy is you can rewrite even to the same exact coverage you have right now with a different company. You just have to be able to answer about 15 or so health questions okay. But that is a definite negative to the supplement plan, as it does go up usually a little bit every year. Number 3, there's no prescription drug coverage as part of your Medicare supplement. The Medicare Advantage plans usually come with that on there. On the MediGap or Medicare supplement plans, you have to just buy a little separate plan called a Part D plan, prescription drug plan. Usually for most people, it's just $10 to $15 a month. Now, granted, if you're on expensive stuff, it can be more than that. But again, the reason that's a negative is it's just another extra cost on there that you usually wouldn't have to pay on an Advantage plan. And number 4, no routine dental, vision, or hearing coverage on a Medicare supplement. So you see all the commercials, you see all that stuff going on the Medicare Advantage is what they're advertising, and they always talk about your dental, vision, and hearing and things like that. The Advantage plans do usually come with those benefits, but I kind of caution people, at least here in Kearney and maybe some surrounding towns, there's not that many dentists in network, so it may not be as good as you think you're getting on that. Now, if you're on a Medicare supplement, the main thing to remember on that is you're really probably getting the best overall coverage based on that max out of pocket limit of just $226 and having no doctor networks. So even if you had to pay a little bit more for, say you wanted a standalone dental plan or a vision plan, that's worth it to a lot of people to have the more comprehensive medical coverage, especially when you get really sick later on. You probably won't care quite as much about your dental benefits. So that's the 4 things I had down for the negatives for Medicare supplements. I want to hear what you think. If you have any comments, go ahead and leave a comment below on what you think about it. Have a good day.